The JT Show, SuperTalk, Mississippi. Dave Hughes in the chair, Rhino in the booth, and on the guest line with us now, the president and CEO of the Mississippi Hospital Association, Tim Moore, joins us here on SuperTalk. Tim, how are you doing today?
Good morning. We're doing as well as we can be expected, I guess.
Yeah, that's probably the best thing anybody can say right now. With the situation as it is, there's probably been more attention paid to our hospitals in the state than at any time in my memory. You know, the hospital is important when you need them, and otherwise a lot of people don't pass them a second thought. That's not the case right now. Everybody's attention is focused on the hospital. Can you give us an update from the Hospital Association about how things are looking in the state of Mississippi right now?
Well, from a hospital perspective, all of our hospitals have been working very diligently to prepare for the anticipated surge and to put, with what resources they have, put everything in place to make sure we take care of the patients in those communities. So the challenges are there. The PPE, the personal protective equipment, is still certainly a challenge in almost all the hospitals across the state. But everybody's working very diligently to try to find what they can to make sure the providers have what they need to take care of patients.
Now, and one thing, and let's get this out right up front. So far, do you know of any shortages of any place in the state where that surge has happened and caused a problem?
Not to my knowledge right now. It has been maintained on the local levels. I don't know of any of our hospitals that have had to transfer patients out because of a surge or an overload. There are certainly, all the hospitals have surge plans in place to be able to move patients, whether it's a system, to move them into another facility of their system, or an independent hospital having transfer agreements to be able to move patients to a higher level of care that may need it.
Now, let me ask you something, and you may or may not know this, but I feel certain you've got the answer to this question, because there has been some talk, and I know this because it's come back to me from several different directions. There's been some talk that if you have the COVID-19 infection and you don't have insurance, you're going to be turned away from the hospital. Is that true?
No, sir.
See, I knew you knew the answer. That's why I asked the question, because a lot of people have that misconception in their mind, and, you know, it's because everybody is still in a state where we're a little scared by this, and as a result, some of these things just kind of get legs of their own and start running around.
No, I would encourage everyone, if they feel like they have symptoms, to reach out and contact a provider so that testing could be scheduled. That's still one of the most important things we can do, is identify individuals that are walking around with the virus that may not know they have it. But if they have underlying symptoms, when they are diagnosed with a confirmed testing, they will be appropriately taken care of at a local facility.
Well, and that's one thing that you mentioned there. I want to pull this out for just a second and emphasize it. Don't go to the hospital. Don't call the hospital. Call your doctor when you first notice the symptoms, right?
That is absolutely right. We do not need someone that is infected and not knowing, spreading the virus unintentionally. Nobody wants to do that. But if they don't know it, then certainly they can create a lot more harm than good. And it can be scheduled so that the providers can be appropriately darned in protective equipment so they can take care of the next patient, and that individual can be routed to where they need to be to get the care that they need.
Now, let me ask you this, and it's kind of a follow-up to that whole point about whether or not you could be admitted to a hospital if you didn't have insurance. This entire thing, from many different aspects, is placing a bit of a financial burden on our hospitals, isn't it?
It absolutely is, and it's not actually it's not the COVID patient. It's the fear and the precautions that have had to be taken and put in place by hospitals, and also from providers, whether it be physicians or nurse practitioners or whoever else, that have eliminated elective cases. So you've created a huge financial burden from the perspective of our hospitals, surgery centers, other people that do other providers that provide elective cases, so there's no income coming in to continue operations of these facilities. Cash flow is a significant concern among our hospitals across the state, and it will continue to be until we get federal funds flowing in to try to fill that gap. So it kind of exacerbates our problem from the standpoint of we've got hospitals that need to be purchasing protective equipment and supplies, and their cash is getting low. And there's only so much of that you can do on credit or whatever, and you need those funds to flow in quickly as possible.
Well, exactly. And the problem is, you were talking about some assistance from the federal level. Do we have a timeline where we might start to see some of that filter down to Mississippi?
I do not. They are, from what we're hearing, they're trying to move it as quickly as they can. I've been in discussion with actually some of the bankers as well that the SBA loans are not even completed yet. A number of the loans certainly have been done, but the paperwork, the banks are still waiting on paperwork from the SBA in order to process them. So that affects many of our small hospitals that can apply to that. And then, of course, we're still in wait of federal money coming. I did hear, of course, as I'm sure you have as well, that the state will be getting significant federal funds, and a portion of that is also earmarked for our community hospitals.
Exactly.
So moving those funds as quickly as possible to them is going to be essential as the surge rises.
Well, and that's the thing that I think we have to look at here is that, yes, the surge is rising, and yes, we already have some financial difficulties for the hospitals, but this is going to continue because even if we hit the peak where the modeling shows us we will in the state of Mississippi, which is April 18th, that's at best only the halfway point. This is a marathon. Do you think that initial wave of support is going to be enough?
Probably not. You hit the nail on the head when you said this is just that's the turning point. We hope you still got a long marathon to run, and of course some of the models are predicting on out to August, the 1st of August, where you see a leveling of the death rate. We all are still continuing to hope for the best, but there are significant risks that are out there. And I know everybody is getting real tired of probably hearing this, but it's so important that we continue to keep people at home, keep them isolated from interactions with others, and, of course, continue to do hand washing. I use hand sanitizer constantly just to be cautious and safe, but the social distancing, staying at home, is much more important than social distancing at this point. That will help bend the curve. That will help the financial situations of hospitals, and that will actually start decreasing the rate of infections that we have.
Exactly. And at some point, we will reach the point to where some of those elective procedures can begin to be scheduled again, which will also help the financial situation. But I don't think that's going to be anytime in the next few weeks, for sure.
Oh, no, I completely agree with that. I think we're looking at a much longer timeline than that. Even if you go back to, you in order to do those elective procedures, you have to have the appropriate gowning and gloves and mask and everything that you need that had to be used to take care of patients. So in those particular facilities, the supply is much less, and the suppliers are not sending items there. They're sending them to hospitals and other areas that are seeing the surge of COVID patients. So all that will have to be restocked.
And how long do you think that might take?
I think that's anybody's guess right now. I did talk to a counterpart in Ohio yesterday, and they're anticipating getting, and I don't think we'll ever be back to normal after all of this. This is going to change the way we all practice and do business. But in their thoughts, in Ohio, they think they'll be back to some sense of normal by the end of August. I think we're probably at least a month behind them on the way the virus moves toward Mississippi. So, you're looking at September. And that's just, that's anybody's guess. I mean, I can't say that with any certainty. I'm just making a prediction.
Well, that's all we can do right now. Can you hold on through the break, Tim?
Yes, sir.
Fantastic. We'll continue talking with the president and CEO of the Mississippi Hospital Association, Tim Moore, when we return here on the JT Show on SuperTalk. On the phone with us now on the guest line, Tim Moore, president and CEO of the Mississippi Hospital Association. Tim, we're seeing a lot of people everywhere that I think are finally giving some well-deserved credit that hasn't been given in the past to the employees of hospitals and hospitals themselves. With a lot of people throwing the word hero around, where before it was just a lot of grumbling about prices. And I think that's a good shift in attitude, don't you?
I completely agree with that, and it's very much appreciated. We've got a lot of men and women across the state of Mississippi that are making an awful lot of sacrifice to be there for their fellow Mississippians, and they always have in a crisis. And even when there's not a crisis, it may be just an individual crisis like a car accident or someone getting injured in a farm accident. They're always there to take care of those patients. And, all of us take that for granted so many times when we're not needing it. But in a situation like this, I'm very appreciative to the outreaching that is going toward our providers across the state. We're certainly trying to do it here as well, and to say thank you for the time, the risk, the commitment that they've made taking care of all of us.
Well, and one of the great things that I have seen in a lot of communities around the state is people coming together and whether it's businesses starting to make gowns, whether it's people at home sewing masks, whether it's local restaurants providing meals for the staff at the local hospital. We're seeing a lot of good things happen in that direction.
No doubt, and that's to be commended as well. People have really come to the forefront. And we're reminded of the greatest generation and all that came about in World War II and how the country stepped up and pulled together to do that. Well, we've really seen that, and this generation that's coming along now certainly, I think, will look back when they get to be my age, look back and say, wow, we were a part of that. And we all pulled together and got through it.
And it won't take that long because Tim's in his late 30s. So,
right.
It's like, I'm not going to tell him any different. Just lean into it, Tim. Just go with it, and it'll be fine. Nobody will know the difference, man.
There you go.
It really is a unique situation. There's really nobody alive now that remembers the last time we had this kind of situation, which was, of course, with the Spanish flu back in 1917 and more impactfully in 1918. So, yeah, we're all having to kind of feel our way through this, and the hospitals are the same way, I would assume.
Oh, no doubt. I did have something I was a little frustrated with this morning, and listening to the Surgeon General talk about I did appreciate the fact that he said that, nobody expected this to be as bad as it is, and who could have prepared. I completely agree with that. It is a much greater run, but then all of a sudden it shifted to it's not all the federal government's responsibility to provide a stockpile. It's the responsibility of the states, and it's the responsibility of hospitals. And me understanding the financial condition of hospitals and where we've been in the state of Mississippi for a number of years, trying to pull our way back financially, there's no logical way to think hospitals could prepare and stock an inventory for a crisis like this that may or may never happen. The financial situation just would not allow that. So certainly, hospitals have been very dependent on the state, and then, of course, likewise, the state on the federal government actually to provide that service for the country.
Do you think it's a fair statement to say?
I think we need to be real careful when we start trying to share the blame, and I don't think there is any blame. I think that there's no way anybody could have seen the magnitude of this in the very beginning. Now, we got some pretty good indications when it started coming from Washington State on down. And there was a lot of work done to get prepared for it.
Let me ask you, do you think it's a fair statement to say that this entire situation, once we get past it and we're looking back at it instead of looking around at it, do you think this is highlighting some problems and some specific problems with the hospital situation, with healthcare in general, that need to be addressed?
Oh, I do. And I appreciate you raising that question, because there's no doubt it raises them. It goes back to what I was just talking about before the break. Is we take for granted our hospitals, and a strong healthcare system is just like the military. You hope you never have to have them, but when you do, you want them there. It's like our fire department and our police force. You hope you never need them, but if we don't have them, we're going to feel real bad when the issue arises that we need them. So maintaining a strong healthcare system across this state, across this country, I think is going to be a challenge that we will all have to rise to.
Well, this has been a discussion before the pandemic broke out. Do you see the possibility, and not even the likelihood, just the possibility of any hospitals in Mississippi winding up being forced to close as a result of the financial hardships put on them during this situation?
Oh, I could definitely see that. I definitely see the possibility of that. When you're looking at a small community hospital, and in many cases, them operating a facility on less than 2 weeks of cash on hand, they could definitely get in situations. And you can just look to other states. Texas has had hospitals closed. Tennessee, Kentucky had a hospital last week that announced closure. And it's already being on the brink of financial failure, and just this little nudge just pushes them on over, and they say, I just can't do it. Think about this as another add-on. We've got a number of hospitals across the state of Mississippi that employ physicians. Those physicians are unable to produce any revenue now. That adds a huge financial burden to the hospitals to continue to employ those physicians, and they're unable to provide any services. So it comes from many, many different directions. When we talk about the pandemic, and the solutions have all been kind of around the pandemic, how we take care of those patients. And sight has been lost that a hospital's revenue is based on surgery and procedures, and really that's where their income is starting. So we've got to keep in mind getting that back up and going, as you alluded to earlier, is extremely important. And then the federal approach to fixing this. And, of course, as I said, I think the state of Mississippi is allocated $1.4 billion to help with all of this. So making sure that hospitals are shored up financially is going to be a huge part of making that a successful investment.
Now, when you talk about elective procedures which have been stopped, and a lot of people, when they hear elective surgery, they're thinking things like, a tummy tuck, getting booty implants, whatever. I'm not sure that's the medical term for that, Tim. But we're talking about things like hip replacements and joint replacements and things that are not life-threatening but really need to be done to improve the health of people, right?
Absolutely. If you've been an individual that's been fighting a bad knee for a couple of years or so, and the pain has gotten to the point that your knee will not operate, then elective procedure becomes pretty necessary to you. It may be a hernia that needs to be repaired. Well, it doesn't have to be done right now, but it needs to be repaired. So those are the things. Absolutely, they're medically necessary procedures that just are not an acute or an urgent situation that has to be done right now.
Well, Tim, we appreciate you keeping us up to date. And you know what? We want to check in with you again as this thing progresses through. Like you said, it looks like it could be a long summer of dealing with this, either the outbreak itself or the fallout from it, either way. So we want to check back in with you again. We're up against the break right now, but check back in with you again and continue to get updates on how things are going with you guys.
Glad to do it. Anytime I can help.
Thank you so much. Tim Moore, the president and CEO of the Mississippi